Okay. Hello, my name is Josue Gutierrez, and I'm currently a sophomore majoring in community health on the pre-med track. And this is my presentation for preventing type 2 diabetes in high risk adolescents on an emphasis on the role of healthy eating and community based strategies. Okay, so a little background to the subject and type 2 diabetes in adolescents. Type 2 diabetes among adolescents is increasing largely due to poor diet and lifestyle factors. Public health is heavily impacted by the rising costs and long term complications of diabetes. Prevention and early intervention are critical to reducing the burden on individuals and healthcare systems. So, as mentioned in the first point, um, many adolescents have a very poor diet um, and lifestyle factors. This may be due to either school lunches in their early years, or I know myself as a college student, it's very difficult to sometimes have the time to like cook those healthy foods. And it's just more easier and convenient sometimes to just like stop at McDonald's or something. Like, it's very time consuming. So, yeah. Then public health is heavily impacted by the rising costs. Insulin is very expensive, and other medications to handle diabetes. So, complications and side effects due to diabetes and having that high glucose level in your body, um, those symptoms of diabetes are being seen more as a result of these high costs because individuals can't afford um, these expensive medications. And then preventing is also essential to reduce all of what we have just talked. Okay, so some statistics are 1 in 5 adolescents in the U.S. are obese, which is a major risk factor for type 2 diabetes, and that is according to the CDC. Another source is the incidence of type 2 diabetes and adolescents has increased by 95% over the last 20 years, and that's according to the American Diabetes Association. And then lastly, healthcare costs related to diabetes exceeded 327 billion annually in the US according to the CDC. So these statistics truly just show us how sad the healthcare system is. If there's not much support even in just like diabetes and many other factors within healthcare. That 1 in 5 adults in the U.S. that are obese, that statistic, that's a very sad statistic to see. Um, because if an adolescent is obese at that early age, we don't know what side effects or what other medical conditions they could arise in the future with that, um, with being obese. Um, and then that last um, point that says healthcare costs related to diabetes exceeded 327 billion annually. That is a very concerning number, being that insulin and inflation, insulin and medications are constantly being impacted by inflation. So that number is just going to continue to rise. So there has to be some intervention done to reduce these numbers, because diabetes isn't going to magically disappear. So we have to start implementing like other ways to come around these numbers, such as like healthy eating habits, stuff like that, and implementing more to individuals at an early age, rather than just um, pushing medication and stuff like that. which would be a good way to like medical schools and uh, individuals within the medical field to acknowledge that sometimes medicine isn't the only option. There's other ways to go about it. And now, some strategies for prevention and intervention are community based education programs, which would teach adolescents and families about healthy eating. That would be at a community level, more of a group one on one type of thing. So it'd be more like personal connections. Another way would be school based meal programs, which would provide access to nutritious foods and reduce processed food intake. So this would just allow that to potentially combat that burden and those numbers of medications. So individuals may need less of those, and we don't and prevent the obesity rate and just an overall healthy lifestyle for in adolescents. And then the last topic would be self management education. This would equip adolescents with tools to manage their health. So just educate them on what is good, what is right. Some individuals may know what is good and what is right, what is good and what is wrong. Some others may not. So using a holistic approach to educate these individuals, maybe in high school, like a class or something, since many of these adolescents are either in high school, college, stuff like that. Maybe like incorporating a class or something. It would just be a great way to help overcome this. And then lastly, access and community support. Access to affordable, nutritious foods in underreserved areas. Community support networks that provide mentorship and resources for healthy living. And then the integration of diabetes management education into primary care and schools. So just a few other points to make within that. And then lastly, here are my references: the CDC, American Diabetes Association, and the World Health Organization. Thank you for your time.